Hello, everybody. My name is Brett Colbo. I'm the Senior Director of Clinical Integration with DispatchHealth. We appreciate your attendance today in a webinar about portable imaging in Washington. We're hoping to go over different ways in which you as a healthcare provider are able to access portable imaging in the Puget Sound area. And so we have a few additional attendees today that will be speaking about different areas of what it means to order an X-ray with PPX, what's appropriate to be ordered, and as well, what you can experience and expect when you are ordering an imaging X-ray with DispatchHealth and PPX. We'll go over our agenda really quickly. We also have a great guest speaker with MultiCare, Lynn Siedenstrang, who will be able to speak towards the partnership with DispatchHealth and PPX. We also have Dean Berger, who will be speaking about working with PPX, and Owen Schunk, who will be speaking about the operational components. We'll then open it up for questions that you might have in regards to what we are going to go over today. I'd like to introduce Lynn Siedenstrang. She's the Vice President of Care Continuum with MultiCare and has been a major advocate for the relationship that MultiCare and DispatchHealth have started and have been working through in the Puget Sound area. So Lynn, I'm going to turn it over to you.
Thank you, Brett. First off, I'm so excited to be here today to talk about a new service that is going to be offered through our partnership between MultiCare and Dispatch. The relationship that we have created with Dispatch has been incredible. And the opportunity to work with them to really focus on developing more programming that allows individuals to receive care in their community versus having to use the traditional hospital-based services has been amazing. Dispatch has had a lot of success in providing their mobile urgent care services. So very excited that we're now expanding those services to include portable imaging in our network with the relationship with PPX.
Thanks, Lynn.
Mm-hmm.
Next, I'd like to introduce Dean Berger, the VP of Imaging Business Development with DispatchHealth and PPX. Dean. You're on mute, sir.
I see that here. Oh, let me try that again. Appreciate the intro there, Brett. And also, Lynn, thank you for joining us. I'm excited to be here as well, as I love to talk about the advantages of having portable X-ray brought to you. So basically, you guys have probably already know about some portable X-ray, but what we have now in the future and what we've got to now is a hospital quality portable X-ray and EKG program provided by PPX, Professional Portable X-ray. We are one of the largest and fastest growing portable X-ray companies in the United States and partnered with another East Coast company as well, covering multiple sections and now proudly to say covering the Puget Sound of Washington. Of course, this is an arm or division of DispatchHealth, and I'd love to tell you a little bit more about it. As you guys are probably well aware of, a lot of people already know about DispatchHealth and basically bringing the quality of the hospital to home, whether it be acute care, also long-term care and bridge care. So a couple years ago, they reached out and they've now expanded what I like to call their hospital on wheels. And they now have a radiology division or department. This is where we come in. We are that radiology department and we bring it to you bedside, at the person's home, at the facility, wherever they may reside. And it is monitored 24/7. We do have some times with it, which I'll get into a little bit later. The imaging facts are, of course, most of these provided are to the skilled facilities, assisted livings, of course, home base. We also do correctional facilities such as jails, prisons. And the fun part is we also do some athletic events too. So if anybody has any kind of facts or anybody that you can get me in touch with the Seahawks, that would be phenomenal. So we look forward to that. We do have a portable machine. It is battery powered. It weighs approximately a little bit less than 90 pounds. The only disadvantage I will say, which is not a huge disadvantage, is we do not do more than 5 stairs, but that is to be mindful of the staff bringing it in, not that they get hurt or it hurts anybody else. But the equipment over time has gotten a lot smaller and way easier to maneuver. And the images are that of hospital grade. Even if you were to send them out, you would not know the difference. With the hospital grade, at the very top, you'll see it's 100% DR, which stands for direct radiography. That's exactly what all the imaging centers and other hospitals are using. Now it's down to a portable unit. So the days back when people watched sci-fi films and saw something very tiny, very robust, that's exactly what we have now. That's what PPX delivers. So with 100% DR technology, that means there's also visualization right there on the scene. So if you guys happen to have a clinician there that is interested in seeing that image, it is immediately viewable. Of course, these are all sent off to the radiologist for interpretation and official results that are called back to you guys and also integrated with any kind of EMR HL7 interfaces that you have. They have a strong footprint, meaning PPX, in each state, and all the neighboring states are the sister company, which is Dynamic Mobile Imaging. But very importantly, we want to focus on the 100% DR-driven quality. With the experienced x-ray techs and the radiologists behind the scenes reading, you guys are going to get the topmost service with this. It is a way more convenient, safe way to image your patient without having to send them out, especially during inclement weather or if there are other risk factors involved. And it's a lower cost to the whole medical community as a whole. It saves that transportation from sending them out via ambulance or wheelchair van. This is something where we bring it to you, and the response times are usually a lot sooner with the urgent cases. Obviously, we are working through a lot of things right now, but we are always in touch with everybody, and ultimately that resident gets to be seen in the safety of their own home or residence, wherever they may be. Again, we're going over basically the skilled facilities, the assisted living, correctional. This was just kind of added back in here. And we also will go to private practices as well, too. If you guys happen to have a standalone facility or clinic and do not have this capability, or we do work with some that have the capability and sometimes the machines will go down, this is where we come in to play. We will be happy to come and help you out with that situation. The studies right now available in your area are 100% DR X-ray and, of course, the EKG. It's a 12-lead EKG, and all these are, of course, interpreted by board-certified cardiologists and radiologists at the end of the day. The X-ray studies available are pretty much anything that you could imagine that you would get in any other clinic or freestanding hospital anywhere. There's a whole list. I'm not going to bore everybody with reading down the list, but basically the only thing that mobile imaging cannot do is any kind of contrast studies, such as barium swallows or gastrograph studies for PEG tube or G tube placements. Coming soon to your area, and we're hoping in the very beginning of the year, 2023, as we ring it in, we're also going to be ringing in the vascular and soft tissue ultrasonography division. These guys are going to be able to come out there again, bedside, do the ultrasound studies, and there's a list of them. Any kind of ultrasound study you can imagine, and it's way easier for me. And if you're clinicians, you're going to understand what I'm saying. If not, there's really only 2 exams in the ultrasound world that is not done mobily, and that is transnuchal lucencies and venous mapping. Everything else we can do bedside there again. And in fact, the ultrasound techs have it way easier than our x-ray techs. They have a briefcase that they carry this around in. The priority exams are put on the venous Dopplers over other exams, just due to the nature of the etiology of the venous Dopplers. So get a little tongue-tied here, but that is coming in the very near future. We're hoping to ring in the new year with that with you guys.
Thanks, Dean.
Thank you.
Next, I'd like to introduce Owen Schunk. Owen is the PPX Director of Operations, and he'd love to go over some of all that we do in the area, including hours of operation and additional information. Owen.
Thank you, Brett. Hi. As Brett said, my name is Owen Schunk, the Director of Operations here with PPX. Happy to join this team and introduce our services to market. As we take a look at the coverage area in sort of our contiguous map, rather, that we have presented on screen, we've got staff that are coming from Olympia, Tacoma, and Seattle, covering a relatively large geographic footprint today. As we continue to see growth in the market, we continue to add resources to maintain those arrival times. We know that priority studies require a particular arrival and turnaround with results. And we continue to assess volumes, projections, and coverage areas so that we can deliver these services to the populations of patients in need in the variety of settings that Dean had indicated previously. To interact with our services, there's a couple of ways out of the gates that we can be contacted, and the easiest way by phone and online as we start to introduce these services and get used to each other. Phone is a good way, I think, to collect some information and set expectations. So we'll ensure that we collect the information we need on the patient, the study, the history, where maybe we need to share the records if there are priors, things of that nature. We like to work with local healthcare systems in markets that we introduce our services to make sure that we can share records amongst one another, understanding histories of the patients to make sure that we can collaborate for positive outcomes. Online portal then is available for order entry, also just record lookup, right? So if you want to visualize the anatomy that we've captured using our digital radiography or EKGs, you can log in and see these images and EKGs in an online, fully diagnostic DICOM quality viewer with zero footprint. This then doesn't require you to have any software loaded on your computer, any required updates, just simply web accessible. We try to make it nice and seamless and intuitive for you to navigate that place. And then as the practices where referring providers are coming out of share coverage, we can pool access patient histories in our online portal and make them available to you more as a team. So looking at a high-level overview, sort of a 10,000-foot view of how the practice of delivering mobile imaging services functions. At the order level, whether coming inbound over the phone or online, Dean also mentioned previously, we have HL7 capabilities. So once we start to mature potentially in our relationship and we want to connect our systems over HL7, we do take integrated orders as well. So as the order comes inbound, we have a central workforce management team that does what we call resource optimization to dispatch technologists to sites from a geographic perspective to also include assessments and considerations like acuity. So if we have a potential fracture post-fall, we're going to expedite the order assignment and arrival for a patient in that space. If we are doing a follow-up on hardware, we're doing some version of something like a TB screening, that might fall behind something that's going to carry a little more acuity to grab our attention. So the order comes in, we see these orders in geographic spaces with our resource optimizers performing the scheduling and the order assignments. Once the technologist is given that assignment, they'll see where the patient is, make a verbal contact to that site. So if it's a congregate care setting, we'll contact the nursing staff that's in care of that resident and communicate our expected arrival times or any patient prep that we might need. So if we prefer to have them upright or supine, essentially imaging them potentially in a chair or in bed, we'll request that they're ready to receive us around the time that we anticipate arrival. Same would be true for a patient that is in a private residence. We communicate typically directly with them or a contact member, POA, that we may have on file in the order, just to make sure they know what to expect as we arrive and when to expect us to arrive. As we arrive to the site, we'll introduce ourselves. At times, we may look to collect some information that surrounds like order compliance. This is more documentation. We typically like to handle that at order entry. Sometimes we'll handle it at site. But we'll otherwise provide the instructions, capture the studies, As Dean mentioned earlier, using direct radiography, we can visualize the patient's anatomy immediately after exposure. Think of it like taking a picture with a digital camera. We can see the x-rays immediately. We'll assess to make sure we have the anatomy visualized appropriately. We will transmit the studies directly from the patient's bedside to a radiologist for interpretation. The radiologist will complete their final read, supply PPX with a final result that we will then distribute out to the client site or the referral source or both to make sure that all the necessary and appropriate parties have a copy of that record. Again, the site where you would log in to potentially place orders or look up records or images would also, of course, have the copy of the radiology results and various ways to notify you when they are ready. And greater detail, of course, and functions and capabilities within that system, but just know that you can ultimately go to this website to access everything sort of in the ordering, scheduling, and reference universe as it pertains to our mobile X-ray service. As I mentioned, there's some documentation requirements that we might have. One of those is a condition of coverage for Medicare certified portable X-ray suppliers, and that is the reason for portability. This is essentially a required statement that we need to receive to successfully intake an order that satisfies sort of the why we are ordering this portably versus sending them out to the hospital. As antiquated as that seems and is, it is still a regulatory requirement for all portable imaging suppliers, not just PPX and Dispatch, but this is a federal requirement. So medical necessity statements, you can see a few examples here. If you've got pain post-fall, the patient is non-ambulatory, bedridden, homebound, suffering from any version of mental status, behavioral issues, all of these are perfectly sufficient as reasons. But it helps to make sure that we can, deliver the service and maintain compliance with the federal government all at the same time. Some other sort of guidelines surrounding orders, symptoms that are relevant to the body part that we're imaging are important. If we are trying to, let's say, rule out pneumonia, we want to know that, but that can't be the only thing that is collected for symptoms. It doesn't support the chest X-ray that you're ordering, for instance. We need to know why we're ruling out pneumonia. So if the patient is coughing congested, O2 saturation has skyrocketed, there's a fever, anything like that to supplement what we are trying to rule out is great. Same is true for fractures. So if we have pain post-fall and we're trying to rule the fracture out, we need all of that at once. There's a handful of things that we can navigate in greater detail, but just know that what we're trying to do is collect relevant and appropriate information to understand the patient's condition. Part of that is regulatory, but more of it is almost clinical. We need to deliver relevant diagnosis history information to a radiologist to ensure that they can give you a comprehensive result in response. So the more detailed we can be on the front end, the more comprehensive we will be with the radiology results on the back. And then as we enroll and provide services in the state of Washington, we are Medicare certified. We are working towards some additional coverage with respect to Medicaid and potentially in a future space, some commercial plans. At this time, we are Medicare and Medicare Advantage ready to process claims. So any services that we will render, part of our document collection will be billable information. We run all of our own eligibility. We'll process that and in that eligibility step, collect primary, secondary, tertiary, and responsibility coverage on our own, submit those claims and manage them on that side. If we render a service in a skilled nursing facility and the patient's under a Part A stay in that setting, then we would negotiate and contract with the facility for Part A pricing. Otherwise, the majority of our services rendered would go directly to Part B to the patient's primary and secondary.
Were there any questions at this time? I did see one question come through from Manina asking, did you say x-rays are available to private practice clinics? And we have responded back with, yes, we can work with private practices to visit patients in the home. But if there are any further questions, would love to make sure that we have the opportunity to answer them for you here. Well, great. We really appreciated everyone's time today in going over everything, the ins and outs of working with PPX as a portable imaging solution for you all. Thank you very much to our special guest, Lindsay and Strang from MultiCare. If you have any questions moving forward in regards to activating an account, questions in regards to the services that we can provide, or ways to be able to access this care, Dean Berger's information is listed here. You can reach him at 804-314-0997, or you can email him at dean.berger@dispatchhealth.com. Once again, thank you very much for attending today's webinar about PPX and Dispatch Health. We appreciate it.